My name is Dr. Paul Siffri with the Steadman Hawkins Clinic of the Carolinas, a division of the Greenville Hospital System. This is an educational video for me to tell you what you can expect over the next 6 to 12 months after undergoing ACL reconstructive surgery. Prior to the actual surgery, we have two main goals. Goal number one is to regain as much knee motion as possible. Obviously, you've lost some of the motion because of the pain and the swelling within your knee. However, we do know that when we operate on a stiff knee, oftentimes the knee can become stiffer after surgery, making it more difficult to obtain knee range of motion. The second goal prior to surgery is to try to eliminate as much of the soft tissue swelling and the hemarthrosis, or the blood that's accumulated in the knee prior to surgery. This again helps speed along the recovery with regards to obtaining full range of motion. Once we come to the day of surgery, you will be seen by the anesthesiologist. Oftentimes, our anesthesiologist will do what's called a femoral nerve block, which is blocking the main nerve on the front of the leg. This helps substantially with postoperative pain control. The procedure, however, is under general anesthesia. The main decision prior to surgery is for you to decide which graft you want me to utilize to reconstruct your ACL. There are three main options. Option number one would be to utilize your own patellar tendon using the central 1/3 of your patellar tendon. Option number two would be to use your own hamstring tendons. And the last option would be to use cadaver or donor tissue to reconstruct your ACL. The surgical procedure itself takes approximately 1 hour. However, that depends upon any other pathology that we may find during the surgery. There may be a meniscus tear that requires fixation or debridement. There may be loose bodies that require removal. There may be some cartilage damage that requires us to debride and stimulate cartilage healing. Post-operatively, in the recovery room, you will have a knee brace placed upon your knee to eliminate any motion. The second thing you'll have is what's called a polar care machine, which is a machine that is wrapped around your knee and provides cold water to circulate around the knee to help with the postoperative swelling and the postoperative pain. The last thing I put on the knee after surgery is what's called a TENS unit. Those consist of 4 electrodes that circulate some electric currents around the knee to help minimize swelling and help control pain. You'll be discharged home from the recovery room with some pain medication and TED hose, which are compression hose to help prevent the risk of blood clots. The postoperative course is quite lengthy, but we are doing physical therapy throughout. As a matter of fact, we generally get you into physical therapy the first day after surgery. At that visit, the physical therapists are instructed to take down your dressings and to inspect your incisions and make sure that the wounds look healthy and there's no significant drainage or concerns of infection. They'll also begin to work on swelling control and begin some early range of motion exercises. Lastly, they will start working on quadricep exercises to help reactivate your quadriceps muscles. In general, you are allowed to put full weight on your ACL reconstructed knee almost immediately, unless there were some other surgical procedures also performed that would limit this. Also, you can start range of motion as tolerated. It's not uncommon that I will send my patients home with what's called a CPM machine, which stands for constant passive motion. It is a machine that you can use at home that will do the motion of your knee for you while you're laying in bed or on the couch. Usually your first postoperative visit to see me is about 2 weeks after surgery. The main reason for that visit is for me to remove any sutures that remain in your knee. It's also to check your range of motion and to check the stability of your knee. You'll be doing physical therapy for 4 to 6 months after surgery, and you and the physical therapist will come up with the appropriate regimen based on meeting certain landmarks. The therapy is aggressive and requires you to be quite diligent both during your therapy sessions and during your own home exercise program. The next visit is usually about 2 months after surgery, and once again, the main purpose of this visit is to make sure you have achieved your full range of motion and also to check the stability of your knee. A lot of times I put my patients in a hinged knee brace, which allows motion about the knee but gives you a sense of stability while you're going through the recovery phase. I tell my patients it's about 6 months to a year before full recovery is obtained to where I would release you to full activities, specifically cutting sports. We have our therapist put you through what's called a sports test, which is a physical test that tests the stability and the endurance and the strength of the operative knee. And once you have passed this test, I will generally release you to full activity. Thank you.